Hello, this is Dr. David Greene with the Texas Pain Network. Today's topic is an overview of medial branch blocks. Back and neck pain affects 90% of Americans at some point. It's the second most common reason people see a doctor behind the common cold. It's a leading cause of disability in those under the age of 45. Up to 40% of those who undergo back surgery are unsuccessful. Actually, 10% end up worse than before. The cost of back and neck pain exceeds $100 billion a year. The facet joints of the back and neck, you can see on this image here, they're these small thumbnail-sized joints on either side of the spine at every level. They are the cause of back pain about 45% of the time. The disc is the cause about 40% of the time, and then you have the SI joints and other things about the other, 15% of the time. These facet joints do have cartilage, just like the hip, the knee, other mobile joints, and they are prone to arthritis. They can be small, but they can be a huge source of pain. Diagnosing the source of one's back pain, it may include a history of physical imaging studies, such as x-rays, CAT scan, MRI. Here's a normal CAT scan on the left, where you see a great looking joint space for the facets on the left and the right here. But when you get to the actual arthritic joint, you can barely see the joint space. It looks all ratty and overgrowth of bone. The joints of the back need to feel sensation just like any other joint. So you have a small little nerve endings that go to these joints called the medial branches. They're not the nerve root, that's what this is right here. But these little nerve endings that come off, they actually go up to the joint right next to it and they go down. So each joint has two nerve areas that come into provide sensation, above and below, okay? There's no motor function with these nerves, it's only sensory. So when a medial branch block is performed, it's performed for two reasons. One is diagnostic, to see if that joint is in fact one of the sources of the patient's back pain. And two, therapeutic. They can actually provide pain relief for quite a while. So most modern pain management doctors use image guidance, either ultrasound or fluoroscopy. Numbing medicine is always injected. Steroid medication may or may not be. It's an outpatient procedure. You really don't need sedation for this. You can just numb up. The doctor can numb up the skin and the soft tissues down to the area. Sometimes oral, like Valium or something, is given. The procedure itself takes under 20 minutes. The diagnostic part helps pain doctors figure out if the joint is the source of the pain. If the injection works well and then wears off, a radiofrequency ablation can then be performed for longer-term pain relief. Okay? So here we're looking at the back of the spine again. Here's some medial branches. So when a pain doctor does a medial branch block, they'll actually do it at the bottom of the joint and the top to try and get both areas numb. The therapeutic part, studies show the average pain relief from the medial branch block is over 3 months. It works well in 85% of patients, and you can repeat the procedure when the pain relief wears off. If the procedure works well and then wears off, patients often go on to a radiofrequency ablation. It heats up and kills those same nerve endings called the medial branches, and that can provide pain relief anywhere from 6 to 24 months consistently. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the Dallas-Fort Worth Metroplex area offering over 25 treatments and accepting over 50 insurances with the board-certified, award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.